Rapid Progress Improvement Workshop is all about saving time for nurses and therapists to care for and prevent pressure damage to patients. We have as a team, Ward 4 staff, physios, OTs, senior staffs from other areas for the last 4 days been working together to achieve this. And here's the agenda for our report out.
We're going to take you through our targets set at the beginning of the week, the current state on Ward 4, what we did, what we've achieved so far, our progress with our targets as of today, our newspaper for the week, and lessons learned. And first I'm going to take you through our targets. We were set 3 targets to achieve. The first target was the reduction in the number of hospital-acquired pressure ulcers. Trust-wide, we were set a target of 50% reduction in hospital-acquired damage. For Ward 4, this equates to a reduction from 25 down to 12 patients. The next target was 100% compliance with the completion of our documentation. We carried out a spot check this week to identify our baseline. Overall, this was measured at 77%. When we looked at compliance with the completion of the prevention and treatment bundle, this equated to 63% compliance on receipt of the patient from EAU. When we looked at the compliance with reassessment, once the patient was on Ward 4, this equated to 22% compliance. We've also been looking at a reduction in waste, and our target for waste was a 10% reduction.
An integral part of the process of an RPIW is to understand the current state or how things happen now. Quite often what we think we do and the time it takes us to do it isn't the same as when you're observed, how other people see it. To this end, the CLIC team visited the ward on a number of occasions, shadowing staff to understand their roles, their frequent activities, and also identify potential areas for improvement by asking staff for their views. This shadowing not only allowed us to look a little bit creepy, but also to produce spaghetti diagrams to show staff movement during frequently done tasks, and also produce process maps to reflect the time spent on activities. During the week we used more shadowing to produce further spaghetti diagrams, as well as to use process maps, and also take a lot of before pictures in order to show the improvements we have made. These actions, as well as hard data from our colleagues in the tissue valuability team and the patient information department, helped us identify the key areas for improvement.
We're going to talk to you about what we did. Leslie and Liz leading the way with a lot of the improvements this week. The first day of the workshop, we learned about some tools that we could use to start our improvements. We took a waste walk using the waste wheel, identifying too much stock, duplication of stationery, poorly labelled stock, meaning lots of time looking for frequently used items. We also noticed that notes were being kept in different locations because they didn't fit in the trolleys. The doctors told us they needed more desk space. Store areas were jam-packed with stock and equipment, making the spaces dangerous and costing staff time to extract the items they needed. We used spaghetti diagrams to map the movement of people and items around the wards, and we talked about our value, what we thought was value. We talked about what value meant for us. All of what we felt most strongly about required us to make the most of our available time, the best way being to reduce waste and non-value added activity. Lots of ideas were recorded. We grouped them into themes and evaluated them and agreed which were the priorities for the ward and our patients. We looked at quick wins and longer term projects. One of the big themes was to reduce the variation in standard processes in pressure care, prevention, treatment, training, monitoring and documentation. Another was communication, to ensure that staff, patients and carers receive information about ways to reduce pressure care damage and can be updated on the improvements from this workshop. We've done communication boards, we've improved the bed and above bed and board round boards. One of the big themes was waste, to be reduced from improving workplace organisation. So we're using the 5S workplace organisation tool. And lots of hard work, blood, sweat and tears. We looked at storage, equipment and stationary areas, and they're now much more organised, current, easy to restock and can be easily maintained without running low or things being misplaced. Using the A3 tools, we captured all the many planned improvements that we've started and hope to continue. To ensure our planned improvements we have looked at PDSA cycles and agreed monitoring tools to try. Before pictures. So that was one of our workspaces that we then used the 5S tool. And for the grand reveal, that room now looks like that. So that's what we have done, amongst many other things this week.
I just want to talk to you about our achievements over the last 4 days. The team have been really busy reviewing the current state to enable us to make the changes to improve our future state, which will ultimately release time to improve our patient care and ultimately reduce pressure care. Claire is going to set us off with some of the achievements.
One of our first of our many achievements, we completed a 5S on the treatment room, working with Lawrence from Stars, reviewed current stock levels and returned excess items, resulting in a saving of £631.69. Lawrence has completed an evaluation of what supplying Ward 4 stock would equate to. This was £6,241. So with the organisation, the cost had reduced to £5,211.05. Time saved for staff invaluable. Example, getting a hoist from a disorganised area could take 2 minutes. It's now reduced to 7 seconds. Standards of care. We are looking to start an SOP flow chart, which is here. From arrival to Ward 4 through to discharge, done through remapping of the process.
We also completed 5Ss at both nurses' stations, which the girls that are here know about. We removed out-of-date paperwork and made each station a mirror image as staff rotate from 4A to 4B, so everyone knows where things are. Drawers have been labelled for quick identification and prompt sheets in place for reordering and topping up of drawers. Overall, this has resulted in a 50% reduction of paperwork on the ward. We've also introduced identifying the frequency of care timings above beds and on the board round boards, and commenced a communication board at the entrance of the ward for the relatives and patients about what our aim is.
The area behind the ward clerk's desk has been reorganised and tidied to create a quiet office space for the doctors and multidisciplinary team staff. There is a computer station in there as well to provide an extra workstation. It is also going to be used as a resource room for students and staff and a central storage location for files and documents. We have also successfully allocated 30 hours a week of healthcare assistant staff to engage patients in activities on the ward to encourage increased use of the day room. This means obviously increased movement of the patients and stimulation. There is further work to be done with this, with the physiotherapists and occupational therapists to continue developing this area, to continue to improve the use of the day room, more regular exercise classes and activities. We are hoping to secure funding for a Renaissance therapy package, which is a computer system for patients with things such as old films, destinations, videos, activities and games, to engage them, which has been found to reduce the number of inpatient falls, the need for one-to-one specials for confused patients, and will obviously increase patient movement, which can only have a positive impact on pressure damage.
We've also ordered 2 new notes trolleys which would meet CQC standards and would free up the back office by centralising the buff notes and the red notes together, therefore giving the back of the nurse's station back to the staff to be able to use a computer and make private phone calls if required. And we've also identified training needs of both qualified and healthcare assistants that you'll learn some more about when Jill speaks.
We continue to measure. When we look at our targets for pressure ulcer reduction, this will equate to a maximum 1 patient per month developing pressure damage on the ward. With regards to compliance with the completion of frequency of care, we started to display this information on day 2, which was Tuesday. This was audited on day 3 and was 100% compliant. Day 4, which was today, we were 93% compliant. But to date there's been minimal communication so it's anticipated that this will only improve. Waste targets, as you've already heard, have been significant. Treatment rooms, by using 5S, 19 minutes have been saved retrieving equipment. By using different care planning documentation, we can save up to 26 hours of nurse time per day. By using 5S, we can save 30 minutes per day in the reorganisation of the admin offices and documentation. By reorganising storage and stock, we can save 2,700 steps daily, ultimately saving time. And by redistributing one item back into the hospital circulation, we've saved £1,000.
So my job today is to tell you about the newspaper. The purpose of the newspaper is to summarise what's happened over the week, to identify what the main achievements are, which you've already heard from the team, and to summarise what needs to happen going forward at 30, 60 and 90 days, and how we're going to monitor some of that progress. So the first area is around, obviously, our target of reducing the number of pressure areas that develop on Ward 4. We've already talked about improving the documentation, and we've talked about some of the standards that have been set about displaying the frequency of care above the beds and on the board round board. So those things are ongoing improvements that we're going to monitor on a daily basis, and we will review at 30 days to see how the compliance has gone with those new standards and decide how often they need to be reviewed from there. We have also adopted some carer prompt cards, which was from some of the work that CPFT collaborative work had done, and we're going to monitor the use of those. So that would be replacing the carer leaflet that was in the bundle. So the team felt that they liked the prompt cards better, so they're going to adopt those and give them a try. All the staff are also going to receive an S-Skim prompt card, and we're going to monitor the impact of that, again at 30, 60 and 90 days. We've developed an audit tool to monitor behind the bed and the board round board, and as we say, we'll do that daily. The next target, as Fiona told us about, is around the documentation. And a big part of that work, as the team described, was developing a new standard around that documentation process. We're going to monitor that standard using an audit tool that the girls have developed during the week, and we're going to weekly audit that process and check compliance in the aim that we will increase our compliance from 77 to 100%. One of the big pieces of work we need to do is make sure that the team are on board with that standard, and then obviously communicate the results of the compliance with that standard. Thank you. We've talked a lot about the reducing waste, which was one of our aims, and that's all about releasing time to care. You've heard about a lot of the work that the team have done in reorganising the workplace, and obviously we need to maintain the improvement and monitor those improvements on a daily, weekly and then 30, 60 and 90 days. We also need to agree with the ward team how we're going to use that time that we've saved to give back to the patients, and we hope to have agreed that with the team by 30 days. Christine and the team mentioned around training. Training was a big theme that came out from this week, and we've developed some targets that we'd like to achieve around training, and those relate to our healthcare assistants being able to document pressure area care, and we want to have a target where 100% of our healthcare assistants can document pressure area care, and that will involve them being trained and then having a competency assessment to be able to do that. So we need to do some work around developing a training package and a competency assessment around that standard. We also recognise that grading of pressure damage was something that we needed to improve, and again we've set a target that we want 100% of our registered nurses to be trained in grading and have a competency assessment on that training. And again, we'll do that by developing a training package and a competency, and then by delivering the training. Thank you.
So as a team, we reflected on some of the lessons learned and thought about things we'd really taken from the 4 days of working together on the workshop. And these are just a few quotes from people as we talked about what did we actually learn from the week. And I think we've already mentioned we've released the time and we really need to refocus that on patient care. And we also reflected that during the 4 days, along with our patient rep who came along for 2 of the days, that we've really focused on patient-centred care. So other things that people have pulled out that they've got from working on this together is learning to see things a bit differently and thinking a bit differently and creatively. Organising the workplace has definitely reduced some of the frustrations that people had coming into the workshop, and I think everyone reflected that improvement is actually hard work but worth it. So we also, as you can see with some of the maps of the current state, we reflected we need to know where we are so that we can actually see where we need to go. Teamwork has been an absolute feature of the whole week, and everyone's worked really together, and we always think we need more prep, which will always help us with this. Other things that have come out of communication and communicating to all of you guys what we've been doing, videoing what we're doing, to ensure everyone knows the great work that the team have done while all you guys have been there supporting them to allow them the time to do this. So the hard work continues into the 30, 60 and 90 days. We have a plan, as Jill's just explained, and as someone said, we really need another week.
The thank yous. Just want to thank our sponsors for allowing us the time and the vision to start the process on Ward 4. Thank you to Karen and her team, and the technical team as well, who's given us all the support and guidance to help us through the process in the week. Thanks to Chris and the home team, allowing us to invade a ward like ants. And of course to all you guys who've been working, hard while we've been trying to work in among yous, and also to the supporting the changes as we've gone along, and to the porters who's helped us take away rubbish, the ward clerks who's helped us with moving stuff about, and all the store staff who's been involved as well with the excess stock, and of course all the team who's been part of the process this week. Thanks to Sue, who's our member of the public. She came in and gave us insight from a patient and carer point of view. She did look after her husband for a few years. Helen Boyd, who came in from the community and gave us her experience and the work they've done. And they did a lot of work on the prompt cards, which we've adopted for our process. I think everyone will agree that it's been a really tiring week. It's been a bit of a roller coaster, sort of up and down. We've achieved a lot in the week, but there's still a lot of work to do for the future. So a lot of hard work to still continue. So thanks to everybody.